Healthcare is one of those things that feels intuitively important, yet becomes surprisingly complex the moment we try to organize, fund, or prioritize it. If you're into this topic, go ahead and like, subscribe, and hit that bell so you won't miss any awesome videos. At an individual level, the reason we need healthcare is fairly straightforward. We want healthy days. We want to be able to work, to earn a living, to enjoy time with friends and family, and to maintain a sense of stability in our lives. Health allows us to participate fully in society, and without it, many of the things we value become difficult or impossible. From this perspective, healthcare supports both personal well-being and productive life years. But healthcare also matters well beyond the individual. From the perspective of governments and societies, maintaining population health is essential for social stability, economic productivity, and the sustainability of public finances. A population that is unwell cannot work effectively, cannot generate tax revenue, and places increasing pressure on public services. Health policy therefore sits at the intersection of social welfare, economic planning, and political legitimacy. This is one reason healthcare consistently appears as a central issue in elections, public debate, and policy scrutiny. Governments do not engage in healthcare provision simply out of benevolence. They do so because healthcare markets do not function in the same way as markets for ordinary goods and services. In healthcare, patients rarely have full information about what they need, which treatments are effective, or how outcomes will unfold over time. Clinicians, by contrast, hold specialized knowledge, creating an imbalance of information. This makes healthcare particularly vulnerable to inefficiencies if left entirely to market forces. The UK Parliamentary Analysis of Healthcare Economics highlights this clearly. Healthcare generates strong social benefits beyond the individual receiving treatment. And without public involvement, provision would fall below what society as a whole needs. Preventive care, early intervention, and population-wide services are especially likely to be underprovided in purely private systems. As a result, healthcare is treated not just as a commodity, but as a public responsibility, closely tied to fairness, social cohesion, and long-term national well-being. Once healthcare is understood as a public responsibility, a deeper challenge emerges. Resources are finite. No system, no matter how well funded, can provide every possible treatment, at every possible time, to everyone who might benefit. This forces health systems to make choices, even if those choices are uncomfortable. At this point, two powerful values come into tension. On one side is fairness, the idea that people should receive care according to need, not income, status, or circumstance. On the other side is efficiency, the need to ensure that limited resources generate as much health benefit as possible. These values are not always aligned. A highly specialized treatment for a small number of people may be life-changing for those individuals, but extremely costly relative to broader public health interventions. Conversely, population-level measures may yield modest benefits per person, but large benefits overall. Healthcare decision-making, therefore, involves value judgments as much as technical analysis. There is rarely a single correct answer, only defensible ones, justified by evidence, ethics, and context. This tension becomes especially visible when we look at healthcare from a managerial perspective. Those responsible for managing healthcare budgets operate under clear obligations. They have a legal and professional duty to manage public funds honestly, efficiently, and within agreed limits. Failure to do so can carry serious consequences, both for organizations and for individuals in leadership roles. In practice, this means regular monitoring of expenditure, close engagement with financial teams, and ongoing communication with line managers and directors. Overspending must be identified early and addressed. Underspending also requires explanation, particularly if it reflects unmet need or delayed care. Importantly, this is not simply an accounting exercise. Financial control decisions have real implications for services, staffing, and patient outcomes. Budgetary responsibility is therefore inseparable from ethical responsibility. A key complication in all of this is uncertainty. Healthcare decisions are rarely made with complete information. Outcomes are probabilistic rather than guaranteed. Interventions that appear cost-effective on paper may deliver variable results in practice. Population needs shift over time, often unpredictably. Managers and policymakers must therefore make decisions without knowing exactly how future events will unfold. They rely on evidence, past experience, and professional judgment, but uncertainty can never be fully eliminated. This is why healthcare decision-making is best understood not as optimization in a technical sense, but as reasoned judgment under constraint. Choices are made between imperfect options, balancing likely benefits, potential harms, and opportunity costs. Recognizing this helps explain why disagreement in healthcare policy is not necessarily a sign of failure. Often, it reflects genuine uncertainty combined with competing values. Healthcare systems also influence behavior in predictable ways. When individuals are insulated from the full cost of care, demand may increase, a phenomenon often described as moral hazard. At the same time, insurance-based systems may attract individuals with higher health risks, placing financial pressure on providers through adverse selection. These dynamics do not imply that public provision is flawed. Rather, they highlight the need for careful system design, incentive alignment, and continuous oversight. Policymakers must constantly adjust structures to balance access, affordability, and sustainability. This again reinforces the idea that healthcare systems are not static. They are adaptive responses to changing needs, economic conditions, and social expectations. For those working within healthcare systems, these issues are not abstract. Improvement often begins with recognizing trade-offs explicitly rather than avoiding them. Clear communication about constraints, priorities, and rationale helps build trust among professionals and the public alike. Small changes, better data use, clearer prioritization criteria, more transparent budgeting processes can significantly improve decision quality, even when resources remain limited. The goal is not to remove uncertainty, but to make better decisions within it. Healthcare sits at the intersection of economics, ethics, and public policy. It exists to support individual lives, but it must be organized at a societal level. Decisions are constrained by budgets, shaped by values, and made under uncertainty. Understanding this complexity is essential, not only for analyzing healthcare systems, but for participating responsibly in their management and reform. This video is part of a series to help you navigate these tricky decisions. If you found it helpful, give it a thumbs up, subscribe, and hit that notification bell.